So what we are is we're an organisation which provides different types of commissioning support services to NHS organisations. Previously, NHS IT was always seen as an in-house service. What we've changed over the course of the last 2 years is to be a service which actually our end users now become our customers and they pay for the delivery of our services, which means that we need to become more IT service providers rather than viewing the way we provide services as an in-house service. So we had a challenge as an organisation around kind of resolving the problems that we had around having users with multiple logins. We had our customers coming to us and saying, we don't want to have 5 different logins for 5 different systems actually. We don't want to be calling a service desk every time we need to do a password reset. We want to have more management around the way that we manage the life cycle of a user within the system from first joiner to leaver. We don't like the way that it's working at the moment.
So we looked at the other cloud leading competitors like Microsoft Azure, Amazon AWS and their identity platforms and their capabilities and feature sets. And they're all like innovating at great rapid pace, but Okta came across as by far the independent leading platform where we can still use those technologies, but Okta would bring them together. So our approach would be we want a multi-cloud approach to deliver that, and Okta was that independent kind of source that was rapidly evolving. We looked at their kind of your growth as well. That really helped to see that they're kind of on the right path where obviously for long term, we want a long-term partner and that Okta can easily deliver that, what it looked like on that market analysis.
If you're a GP who comes into a practice on a daily basis, what you're really confronted with is a number of systems which you need to log on to be able to provide your care service. Each one of those systems and services have a different set of log-on credentials, username, password. Sometimes they use smart card authentication. And Okta will come in there and actually simplify that environment. So it adds efficiency to the way that the GPs will be able to provide their service. Ultimately, if we can reduce the time it takes for patient contact for a clinician, it actually means that clinician can then see more patients during the time of their sessions, and that improves efficiencies within the service and is also a cost saver for the NHS.